Welcome to Scalp Acupuncture 12, presented by Lamp Acu Wellness Foundation, Inc. Yamamoto New Scalp Acupuncture. Yamamoto New Scalp Acupuncture was invented by Dr. Toshikatsu Yamamoto of Japan. He developed the scalp acupuncture system, influenced by Chinese acupuncture and Chinese scalp acupuncture, as well as his own clinical experiences. The first reports about YNSA were at the 25th annual meeting of the Japanese Society of Ryodoraku in Osaka, Japan, in 1973. In order to distinguish Japanese scalp acupuncture from Chinese scalp acupuncture, this system is called Yamamoto New Scalp Acupuncture, YNSA. Yamamoto New Scalp Acupuncture should be classified as a somatic representation or microsystem. The YNSA points are divided into the following four groups: 9 basic points, 4 sensory points, 12 Epsilon points, and 3 brain points. YNSA is a fast-acting, reliable, and time-saving method. Dr. Yamamoto also used abdominal diagnosis and neck diagnosis to achieve better clinical results. Locations and indications. 9 basic points. The 9 basic points are A, B, C, D, E, F, G, H, and I. YNSA in basic points are located mainly along the frontal hairline on the forehead, on either side of the midline. All of the in basic points are also reflected bilaterally in the posterior scalp around the lambdoidal suture area as yang basic points, except the basic F point. Forehead in basic points include the points A, B, C, D, E, G, H, and I. The basic F point is located behind the ears over the mastoid process, which is only in the occipital yang area. The basic points H and I are extralumbar points, and they are situated in a caudally continuous line to the basic B and C points. The basic point representation areas are A, head, cervical, spine, and shoulder; B, cervical spine, shoulder, shoulder joint, scapular region; C, scapular region, shoulder joint, upper extremities; D, lumbar spine, lower extremities; E, thoracic spine, ribs, lungs, and heart; F, sciatic nerve; G, knee; H, lumbar; I, lumbar. Basic A point. The yin basic A point is approximately 1 centimeter bilateral to the midline of the forehead area and approximately 5 centimeters anterior to the coronal suture. The A point is subdivided into A1 through A8, following a vertical line from anterior to posterior for a total length of 2 centimeters, with A3 at the anterior hairline. A1 is about 1 centimeter inferior to the hairline. A8 is 1 centimeter above or posterior to the hairline. Yang basic A point at the posterior scalp area. It is also 1 centimeter bilateral and subdivided into A1 through A8, with the same indications as the in basic A point. Indications: pain relief after injury or surgery, headaches, cervical syndrome, whiplash, vertigo, trigeminal neuralgia, facial, neck, or shoulder neuralgia, toothache, cerebral disturbances, and facial paralysis. Basic B point. Yin basic B point is approximately 1 centimeter bilateral to the basic A point, or 2 centimeters bilateral to the midline at the hairline. Yang basic B point is only 0.7 millimeter lateral to the Yang basic A point due to the smaller area. Indications: treats all pain after injury or surgery, neck, shoulder, arm syndrome, shoulder pain due to arm fractures, and hemiplegia. Basic C point. In basic C point is approximately 2.5 centimeters bilateral to the basic B point, or 4.5 centimeters bilateral to the midline. The basic C point can be subdivided into 9 smaller parts for a line 2 centimeters in length. The basic C point line runs at a 45-degree angle from the bridge of the nose to the corner of the forehead. The basic C point represents the upper extremities, followed by the upper arm, elbow, forearm, and hands. Yang basic C point at the posterior scalp area with the same order. Indications: post-traumatic and post-operative pain, frozen shoulder, dislocation of the shoulder joint, sprained joints, fractures, rheumatoid arthritis, bursitis, tennis elbow, tenosynovitis, hemiplegia, paraplegia, Parkinson's disease, multiple sclerosis, paresthesias, and circulatory disturbances. Basic D point. In basic D point is in the temporal region, approximately 1 centimeter superior to the zygomatic arch and 2 centimeters anterior to the ear. The basic D point is bilateral. The divisions of the basic D point are D1 through D6 and are located similarly to a string of beads in a vertical line about 1 centimeter in length, posterior to the basic D point and just anterior to the ear, superior to the temporomandibular joint region. The basic D point represents the entire lower part of the body, including the lumbar vertebrae and lower extremities. The basic D1 through D6 points represent the lumbar spine, sacrum, and coccyx. They are located in the same order as their anatomic positions. The basic D1 point represents the lumbar vertebrae. The basic D2 through D5 points represent lumbar vertebrae 2 through 5, and the basic D6 point represents the sacrum coccyx area. Yang basic D point, located in the same manner over the sphenoid bone toward the edge of the temporal bone. The divisions D1 through D6 are not precisely reflected. These points are in a higher position just behind the ear in a slightly curved, more horizontal line, 1 to 1.5 centimeters in length. Indications: treats all post-traumatic or post-operative pain and motor disturbances, such as herniated, intervertebral disc, Raynaud's syndrome, neuralgia, rheumatism, arthritic muscle cramps, sciatica, hemiplegia, paraplegia, Parkinson's disease, multiple sclerosis, fractures and sprains, gout, and prostatic hypertrophy. Basic E point. In basic E point, located superior to the eyebrows, starting approximately 1 centimeter lateral to the midline and 2 centimeters long. It is a 15-degree oblique line extending laterally. The basic E points are bilateral. The basic E point has 12 subdivisions and represents the thoracic vertebrae, the ribs, and thoracic cavity, and the internal organs innervated by the thoracic nerves. The basic E1 point is the most superior and represents thoracic vertebra 1. The basic E12 point is closest to the nose. Yang basic E point, located in the occipital position. Indications: treats all post-traumatic or post-operative pain, such as intercostal neuralgia, herpes zoster, fractures, angina pectoris, palpitations, asthma, dyspnea, and bronchitis. Basic F point. The basic F point only has one yang point, which is located bilaterally in the yang area over the highest point of the mastoid process. Indications: sciatic nerve problems. Basic G point. In basic G point, located above the basic D point in the temporal region close to the anterior hairline. The basic G point is divided into 3 points located in a horizontal line. Yang basic G point, located around the mastoid process below the basic F point and distributed in a triangle form. The basic G1 point is the most anterior, and it represents the medial aspect of the knee. The basic G2 point represents the frontal area of the knee, and the basic G3 point represents the lateral side of the knee. Indications: treats all types of post-traumatic pain of the knee joint and patella, such as bursitis, rheumatism, arthritis, patellar fracture, and sprains. Basic H point. The basic H point is present in the yin and yang positions. It is a supplemental point in addition to the basic D point to treat lumbar pain. It is located almost directly above the basic B point. Indications: same as the basic D point. Basic I point. The basic I point is present in the yin and yang positions. It is also a supplemental point in addition to the basic D point to treat lumbar pain. It is located 1 centimeter from the basic C point, extending at a 45-degree angle. Indications: same as the basic D point. The 9 basic points are mostly used to treat motor nerve dysfunctions such as paralysis, hemiplegia, paraplegia, dysfunction, and pain caused by injury, surgery, inflammation, and pathological changes such as tumors or herniated discs and dysfunction of the internal organs. Sensory points. There are 4 sensory organ points: eye point, nose point, mouth point, and ear point. Location. Each sensory point represents a particular organ or anatomical structure. They are all located on the forehead below the anterior hairline. The eye, nose, and mouth points are located directly below the basic A point in a vertical line approximately 1 centimeter from each other and 1 centimeter lateral to the midline. The ear point is about 1.5 centimeters inferior to the basic C point on a 45-degree line between the basic C point and the bridge of the nose. All sensory points are also repeated in the occipital area as yang representations. Indications: eye point. All ophthalmic disturbances and pain, such as impaired vision, glaucoma, conjunctivitis, strabismus, and post-traumatic or post-operative pain and discomfort. Nose point. All conditions affecting the nose, such as allergic conditions, rhinitis, sinusitis, nasal obstruction, nosebleeds, and post-traumatic or post-operative pain. Mouth point. All conditions affecting the mouth, such as stomatitis, herpes, toothache, and aphasia. Ear point. All auricular disturbances, such as tinnitus, deafness, and post-traumatic or post-operative pain. The four sensory points are used to treat dysfunction, pain, injury, post-operative pain, and allergic conditions of the sensory organs. Brain points. There are three brain points: cerebrum point, cerebellum point, and the basal ganglia point. Both the cerebrum and cerebellum points are located bilaterally 1 centimeter lateral to the anterior posterior midline and directly above the basic A1 point. The basal ganglia point is located between the cerebrum and cerebellum points on the midline. All brain points are also present in the same manner in the occipital yang area. Indications. The three brain points can be used to treat many neurological diseases and disturbances, such as motor disturbances, hemiplegia, paraplegia, migraines, trigeminal neuritis, Parkinson's disease, multiple sclerosis, endocrine disturbances, vertigo, disturbed vision, tinnitus, aphasia, epilepsy, insomnia, depression, and psychological disturbances. The brain points are valuable to acupuncturists as well as neurologists for a variety of conditions. These points are mainly used to treat central nervous system disorders. 12 Epsilon points. The 12 YNSA Epsilon points represent the internal organs. Y1 is small intestine, Y2 triple heater, Y3 large intestine, Y4 stomach, Y5 liver, Y6 spleen pancreas, Y7 gallbladder, Y8 kidney, Y9 bladder, Y10 lung, Y11 pericardium, Y12 heart. The Epsilon points are a dense collection of points located in the temporal region. The foundation of the Epsilon points theory is based on Oriental medical theory. The Epsilon points must be determined in each patient, and with every treatment by using the new modified method of YNSA abdominal and neck diagnosis. YNSA Epsilon points are all present in both the yin and yang regions of the temple area of the head. The yang points are slightly lower than the yin points. Epsilon points are used to treat dysfunction, disease, or imbalance of the internal organs, as well as motor disorders or disabilities. Epsilon point locations. The 12 Epsilon points are located bilateral to the small area of the temporal region, approximately in the region between the anterior and superior auricular muscles. A vertical line from both sides of the ear apex is divided into Y points, with the frontal yin Y points and the posterior yang Y points. A slightly oblique horizontal line marks the border of the inferior strong Y points and the superior weak Y points in both the yin and yang positions, which results in 4 sections: lower frontal strong yin, upper frontal weak yin, lower posterior strong yang, and upper posterior weak yang. Indications: dysfunction of any internal organs, in addition to any motor, functional, or psychological disorders such as headaches, migraines, trigeminal pain, facial palsy, chest pain, dyspnea, asthma, bronchitis, angina pectoris, and cardiac arrhythmia. Digestive problems such as diarrhea, constipation, peptic ulcer, hepatitis, pancreatitis, and cholecystitis. Cerebral disturbances such as hemiplegia, paralysis, cerebral palsy, and multiple sclerosis. Cervical, thoracic, lumbar, and coccygeal pains of various origins, and osteoporosis. YNSA abdominal or neck diagnosis is essential before determining which Epsilon point can be treated. Palpate all of the diagnostic areas or zones in the abdomen or neck for any pathological changes, such as tenderness, hardness, or swelling. Thank you very much for your attention and hope to see you on our next videos.